Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Upper GI endoscopy and colonoscopy. Introduction. Upper GI endoscopy and colonoscopy are simple procedures that allow your healthcare provider to look inside your digestive tract. They help to discover certain diseases, such as ulcers, cancer, and inflammatory diseases. Your healthcare provider may recommend that you have an upper GI endoscopy with a colonoscopy. The decision to have these procedures is yours. Upper GI endoscopy is also known as EGD for esophagogastroduodenoscopy. EGD and colonoscopy can be life-saving. This program explains the advantages as well as the possible risks and complications of EGD and colonoscopy. Digestive system. Swallowed food passes through the esophagus, also known as the feeding tube, then through the stomach, where it is partially digested. Digested food travels from the stomach to the small intestines, where nutrients are further digested and absorbed. The small intestines are divided into three parts: the duodenum, the jejunum, the ileum. Digested food that has not been absorbed in the small intestines then reaches the colon. In the colon, the remaining nutrients get absorbed and stools are formed. Stools are then stored in the last section of the colon between the sigmoid and the rectum before being excreted. The colon is made up of the following parts: the ascending colon, the transverse colon, the descending colon, the sigmoid colon, the rectum, and the anus. The digestive system is also known as the gastrointestinal tract, or GI tract. Diseases of the GI system. Various GI symptoms can be investigated and possibly treated with an EGD. These include pain in the stomach or abdomen, vomiting, bleeding or ulcers, tumors, indigestion or chest pain, difficulty swallowing. Colon diseases can also be diagnosed and possibly treated with a colonoscopy. This includes colon cancer, which is one of the most common cancers among men and women. This cancer tends to run in families. Colon cancer usually starts as an abnormality called a polyp, which dangles inside the colon. Not all polyps result in cancer, but they should be monitored closely. Recent research has shown that some patients may have a specific genetic predisposition to not only develop colon cancer, but also prostate cancer. Colon cancer can lead to blood in the stools as well as a change in bowel movement habits. Other diseases of the colon include chronic inflammation or infections of the colon. They can lead to diarrhea and possibly bleeding. Some of these diseases, such as ulcerative colitis and Crohn's disease, can lead to colon cancer. Endoscopy. EGD and colonoscopy are endoscopic procedures. This means a healthcare provider uses a long and thin fiber optic tube called an endoscope to transmit pictures from inside your body. The healthcare provider can either look directly into the scope or see the pictures projected onto a TV monitor. Endoscopic procedures show more details than pictures taken with X-ray. The endoscope has an open channel that allows instruments to be passed in order to take tissue samples, stop bleeding, or remove polyps. The healthcare provider that performs the endoscopy to examine the upper GI tract and the colon is a gastroenterologist, a specialist of the digestive system. In some cases, an endoscopy can be used to treat the disease. For instance, if polyps are found in the duodenum or the colon, they can be removed. Polyps are abnormal growths of the GI lining. Polyps begin as non-cancerous tumors, but some types of polyps can turn into cancer. If you have a polyp, your healthcare provider will remove it and send it to be tested under a microscope to determine its type. Cancerous growths, if found, can also be taken out for further examination. This is called a biopsy. Biopsies are also done to test for certain bacteria that cause ulcers. Active ulcer bleeding can also be treated during the endoscopy. If the source of bleeding is found, it can be sealed, which can stop the bleeding. Abnormal-looking tissue can also be taken during an endoscopy. The tissue is sent to a pathologist who examines it under a microscope to determine if other possible diseases, such as Crohn's disease or ulcerative colitis, are present. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Alternative procedures. A barium study is a radiological test that allows the healthcare provider to see an X-ray of the upper GI tract or colon. A barium enema does not provide actual pictures of the GI tract. Biopsies are not possible with a barium enema. CT scans can also be done to see the inside of the intestines. A capsule can also be swallowed, and it can send pictures to a computer on the outside. These pictures can then be seen by a physician. This is known as capsule endoscopy. EGD and colonoscopy are the only available procedures that not only allow your healthcare provider to look inside the colon and GI tract, but to also remove small samples from abnormal areas. Before endoscopy. Endoscopy can be performed in your healthcare provider's office, a GI clinic, or at the hospital. It is usually an outpatient procedure. This means that you will go home the day of the procedure. You should not eat or drink anything for 8 hours before your scheduled procedure. Food in the upper GI tract will block the view and hinder the examination. It can also cause vomiting during the procedure. You should avoid the use of aspirin or products containing aspirin or blood-thinning products such as Excedrin, ibuprofen, Motrin, Advil, Aleve, or similar products 7 days before the procedure. Taking aspirin products can increase the risk of bleeding during or after the procedure. After your procedure, your healthcare provider will tell you when it is safe to begin taking these medications again. You should not smoke after midnight the day before the procedure. For the colonoscopy part of the procedure, the colon needs to be very clean. For this reason, you will be given a strong laxative. The laxative will cause significant diarrhea, cleansing the colon of any stool. You will also be asked to go on a clear liquid diet for 1 or 2 days before the procedure to help prevent stool from forming. Tell your healthcare provider about any medical problems you may have. Problems with the lungs and heart, for instance, may require special treatment before, during, and after the endoscopy. If you have diabetes, please inform the person scheduling the exam that you will need an early appointment time. Tell your healthcare provider about all the medications you are taking. If you take blood thinners, for example, you may need special medications. Also, inform the healthcare provider if you have any allergies. This will help your healthcare team select the right analgesic for you. This is the medication that will numb you to pain for the procedure. You will be asked to remove your shirt and put on a gown for the procedure. If you wear glasses, dentures, or partials, you will be asked to remove them before the procedure. You may want to bring a case with you to store your glasses. A denture cup will be provided for you. Procedures. Before the procedure, you may be given a sedative to help you relax, or you may be given medication that will put you to sleep. If you are sedated but not asleep during the procedure, it is important that you try to relax and take slow, deep breaths through your nose. Every effort will be made to maintain your comfort and safety. Most patients fall asleep through the procedure. Your blood pressure, pulse, and the oxygen level in your blood will be monitored. The procedure usually takes about 5 to 10 minutes to complete. You should feel no pain during the procedure, and you will be able to breathe on your own. Before the EGD, the healthcare provider will give you a local anesthetic to numb your throat. This may be a spray or a medication with which to gargle. You will lie on your left side. An endoscope will be inserted into your throat and you will feel some pressure. The endoscope will blow some air into your stomach so that the healthcare provider can see well. Some patients consider the test slightly uncomfortable, while others do not. The esophagus, stomach, and duodenum are examined carefully during the EGD. Your healthcare provider will look closely at areas that require evaluation, diagnosis, or treatment. They will look for inflammation, bleeding, abnormal growths, or other abnormalities. If the healthcare provider sees abnormal tissue, they will take a sample for examination under the microscope. This is called a biopsy. Biopsy is helpful in determining whether abnormal growths are cancerous. It can also help determine if bacteria causing an ulcer is present. The biopsy results are usually available a few days later. If active bleeding is found, such as bleeding caused by an ulcer, the healthcare provider can stop the bleeding using the endoscope. At the end of the examination, the healthcare provider will withdraw the endoscope. For the colonoscopy procedure, another flexible scope is inserted inside the colon through the rectum. As the scope is introduced into the rectum, you may feel the urge to defecate. This is normal. Let your healthcare provider know if the sensation persists. He or she can give you more medication to relax you. After inserting the scope inside the rectum, the healthcare provider looks at the sigmoid and descending colon. Next, the healthcare provider proceeds to the transverse colon. Finally, the scope is taken to the ascending colon. If your healthcare provider finds abnormal tissue, he or she may be able to remove part or all of it and send it to the lab. A pathologist then examines the tissue under a microscope and determines whether it has evidence of cancer or other diseases. When the colonoscopy is finished, the healthcare provider removes the scope. The colonoscopy is usually not painful, but the patient may experience some discomfort. When you are done with the two procedures, you will be taken to a recovery room to wait for the effect of the medication to wear off. This may take up to 1 hour. You will then be discharged and allowed to go home. Your healthcare provider may give you the preliminary results before discharge, but if any biopsy was done, these results may not be available for a few days. When you are ready to go home, you should not drive a car. Arrange for somebody to drive you home. Risks and complications. EGD and colonoscopy are safe procedures that could be life-saving, but they have possible risks that you should learn about. Some patients may be allergic to the sedative used. Tell your healthcare provider before the procedure if you have any allergies. This will help him or her pick the right sedative for you. Bleeding could occur during the procedure. This is rare, but more likely to occur if a biopsy is performed or if the patient takes blood-thinning medication. Bleeding usually stops on its own, but in rare cases may require a blood transfusion. In extremely rare cases, open surgery may be needed. The lining of the digestive tract can tear. This may require surgery to repair. This is also rare. Occasionally, the colon is not as clean as it should be. In this case, the colonoscopy may be postponed. If tissue is removed, some bleeding from the rectum could occur. This is usually a small amount. Complications of an existing heart or lung disease can occur, but are rare. After the procedure. You should be able to go home the same day of the procedure, but you will need somebody to drive you. Your healthcare provider may recommend that you rest at home the day of your procedure. Be sure to call your healthcare provider if you have severe belly pain, fever, or belly distension, where the belly gets bigger very quickly. Though you will feel stronger as you go home, you should plan on resting for the rest of the day. You may have a sore throat, bloating, or cramping. These are normal side effects and should go away within 24 hours. Your healthcare provider will tell you how soon you can eat, drink, and resume your regular activities. Normally, you can eat after the procedure. Call your healthcare provider right away if any of the following happen. 1. You have trouble swallowing. 2. You have throat, belly, or chest pain that worsens. 3. You vomit. 4. You have blood in your bowel movement. Stool looks black or very dark when they contain blood. 5. You have a fever. Your healthcare provider may schedule a follow-up appointment to give you the results of your biopsy. You may also need to have regular colonoscopies done to make sure you don't develop tumors or cancer. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Upper GI endoscopy and colonoscopy are two safe procedures of the digestive system. They can be used to diagnose and treat medical problems in the stomach and small and large intestines. It is important to communicate with your healthcare provider about your health conditions and the medications you take. Do not eat or drink anything for 8 hours before the procedure. Some medical conditions, such as diabetes, will affect the length of time you can go without eating or drinking, so check with your healthcare provider. Thanks to advances in medical technology, endoscopy allows better diagnosis than X-rays. Endoscopy can also be used to treat some medical conditions, thereby avoiding surgery. Thank you for using Explain.